If we survey patients and ask them what they want from their providers, aside from the obvious of medical accuracy in diagnosis and treatment, they express three things. Number one, they want us to know them. Number two, they want us to listen to them and respect them. And number three, they want us to give them enough time. I suspect that all of us have had the rather disconcerting experience of going in to see a doctor or the provider and have the feeling that they don't know who we are. They might be leafing through the chart as they talk to us, or they might be pecking away on the computer looking up our record. One time, I had the experience when I went with my teenage daughter for an ACL repair. We were waiting in the little curtained-off pre-anesthesia area, and the orthopedic surgeon came in and looked at her and said, "Okay, which knee is it?" Really? You're going to operate on my daughter and you're not certain which knee it is? Rather disconcerting. So yes, of course, our patients want us to know them, and the first tip is to look at the chart before going into the room. It's very easy to look at the last note that we wrote, or maybe just check the list of the patient's problems so that we're familiar with them when we walk in. Another bit of advice is that if the staff has done some pre-visit testing, maybe someone's come in with a sore throat and so they've had a throat culture done, it's best not to walk in and say, "Well, hello, what brings you in today?" Because the patient's going to wonder, well, doesn't he know that the staff has already done something? Instead, one could say something like, "Hello, it's nice to see you. I know my staff has taken a throat culture, but I want to hear more about your symptoms and how they developed." You walk in with knowledge. This is reassuring to the patient. So, the first tip in this series is to review the chart before going in with the patient. Thanks for watching, and we'll see you again very soon with another tip for improving the patient experience.